I mean, but this is what's happening to a lot of patients.
I had a conversation one time with a doctor, and he goes, it was some conversation about treating patients early. He goes, well, there's not enough evidence. There's not enough evidence. I need to wait. We need to wait for large randomized trials. Do you know in the U.S. Senate testimony, the minority witness multiple times told us, he goes, nope, these doctors are treating with these drugs. There's not enough evidence. There's not enough evidence. And then I think Ron John asked him, he goes, well, what do you think the best treatment is? Well, they should follow the guidelines. And the guidelines say stay at home and wait until you really can't breathe anymore. And then you come to the hospital. Then you start treatment. And then I made a comment. I said, I want that to be written into the records of Senate testimony that is a reckless recommendation for America, that it is reckless to recommend nothing in the setting of a fatal illness. Every serious fatal infection must be treated early. It's only going to get worse. We actually have, for other infections, we have time to the initial therapy as a benchmark of quality of care. Why would we let this virus rip the body for 14 days or longer? Can you imagine you had it? Can you imagine if you were 75 years old, you had heart and lung disease, and you were sitting in your apartment, your parents, your kids couldn't come over and look after you, nobody could look after you, and every day you're stewing, getting worse and worse and worse and worse, until finally, and you're in isolation, finally at 2 weeks you can't breathe anymore, and you toss in the towel. You call 911, you call your daughter, you call your son, you contaminate the virus everywhere, and then you get put in the hospital, you get slammed into isolation, you get put on remdesivir, you get 6 milligrams of Decadron, and then to make things absolutely the worst, you never see your loved ones again and you die. That's what's happened to 800,000 Americans.
And so this is why you believe that at least 50% of those people those deaths could have been prevented.
That was in November of 2020 under sworn testimony. That number's easily 85% now. Maybe it's 90% now if we got what you got. If you got the sequence multi-drug treatment, monoclonal antibodies, you called it the kitchen sink, so do I. Bottom line is it may be refined over time. The Merck and Pfizer drug, we'll bring them in. If other drugs come along, we'll refine it. Listen, it's a process. I'm not saying any one of these drugs is a miracle drug. None of them are necessary nor sufficient to save a life. But the point is, what drives hospitalization is uncontrollable symptoms. It's uncontrollable anxiety. Do you know an anxiety drug itself actually cuts off the risk of hospitalization?